Dr. Salim Sourani joins us live to discuss more about Merck's COVID pill. Dr. Sourani, when you heard the news that they were applying for emergency use authorization, what was your reaction and what are your takeaways and some of that criticism that we're hearing? Do you agree with it?
Good morning, John Thomas. Glad to be here. One of the key thing is we discussed about some of the oral pill. Merck was one, and then we have one coming in pipeline from Pfizer and one from Roche. And if you look at it, even in the flu is the classic example. We have the flu vaccine, but it's still we know that there is a breakthrough infection or some people who may not have taken the vaccine. If they get sick and get admitted in the hospital, that can be a very challenging and same scenario we have seen in COVID-19. So this pill, molnupiravir, offers pretty much the same hope that someone who either get a breakthrough infection or someone who has not been vaccinated, and as soon as they turn positive in the very initial part, and if they have mild symptoms, they can get the pill, and that can prevent the hospitalization and death. And that is the main purpose. But one thing we need to know that the pill is not a replacement of a vaccine, because vaccine prevents. Pills start working and act after you get the infection, and we know that it prevents 50% of the hospitalization. It means if you are 1 out of 2, you can get admitted in hospital still. So I think there is a good hope. The pill can reach at the area where we have a shortage of vaccines. And again, pill is easy to produce and replicate.
Is this something that we'll be able to buy over the counter, that we'll have a chance to just stockpile if we need to? Or I know you don't want to hear that word stockpile, but at least get I don't know, like a box that has a couple in there for the family in case we get sick? How does that play out?
One of the things is I don't think so we are going to look into is getting over the counter. It's an expensive pill. The price which has been thrown around for the course is $700 per course of the medicine. One of the good things is what the Merck has done is that realizing it would be a global shortage, they can only make up to 10 million courses for this year. They probably will be allowing some of the generic drug maker in India and some other countries to maybe replicate the pill so the pill can help and reach the other part of the world and try to save lives. And hopefully we can try to, prevent the hospitalization and the disaster which it comes with that.
Okay, Dr. Sourani, we've run out of time for this half hour, but we will be visiting with you at 6 o'clock, and we will be discussing the governor's new mandate against his new ban that is against vaccine mandates. So if you have questions regarding that or the COVID pill, simply send us a text at 361-855-6397. Dr. Sourani, always a pleasure visiting with you. Thank you for waking up so bright and early with us.